You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have Dr. Jason Barganier. Dr. Barganier, welcome to the program.
Randy, how you doing?
Good.
Nice to see you.
Now, before we get into today's topic, and I know you brought a lot of photos, so we'll get to as many of those as we can, and they're dramatic. Who's the typical implant patient that you see?
Randy, there's two types of dental implant patients that we see. Number one is somebody who has teeth that are not doing so well. Generally, you can see decay socially. Sometimes their teeth are flaring out a bit, which indicates an infection that needs to be treated. They've had a rough time with the dentist in the past, and they don't want to come back.
Now, they come to you because they don't want dentures, right?
They come to
Is that your reputation out there?
Absolutely. They want to stay away from dentures. Dentures is a four-letter word. For a lot of people, they're scared of them. It is the end of life as they know it, and you can see it in their face when they come in. One of my greatest joys is telling people they don't need dentures. It's fantastic.
Okay.
I can save people tons of money and a lot of stress and a lot of worry by just talking to them about their teeth. If I can get people into my chair and just have a really nice, wonderful conversation, and then talk about their teeth. A lot of times, people's worries and fears are much, much greater than the actual truth about what's going on with their teeth. The second group is denture wearers. They are people that have had the experiences of the first people. They've chosen to get a denture, and the denture fit well for a really long time, and it was a wonderful fix for them. But eventually, things changed, and the denture got loose. It got ill-fitting. It pinches them when they eat. They can't eat a lot of the foods that they used to, and they want to find something better.
Okay.
Today, in dentistry, dental implants fills that role. We can give people a third set of teeth that honestly wasn't available 10, 20 years ago.
Now, is it true that with certain patients, I mean, they could literally walk in with a denture or with no teeth and walk out with teeth?
Absolutely.
Is that right?
Absolutely true, yes. Dental implants, when you bridge them together, can create a structure for teeth that is immediately convertible to actual teeth. People walk into my office, they sit in the chair, they take a little nap in general. We offer sedation where we can give somebody nitrous just to make them feel nicer.
Okay.
We can give them a pill to make them feel even a bit more nice, very comfortable in the chair. And then we also have IV sedation where they do not experience dentistry again. A lot of people choose that route because dentistry, honestly, I'm a dentist.
Nobody likes going to the dentist, right?
Nobody likes it.
Do you hear it? Do they ever say, "Hey, no offense, doctor," but
the nice ones say no offense. Yeah, yeah.
Right? Okay.
I hear it. Honestly, I don't like the dental chair. I don't like getting my teeth fixed. It's dentistry. It can be unpleasant.
Yeah.
And for the people who do not want to experience it again, we have IV sedation, which is fantastic. People come in, they get their teeth worked on under sedation, whichever form they choose. Yeah. IV sedation allowing them not to experience it. They wake up, we give them a new set of teeth that does not come out unless they come back to us to have it unscrewed, cleaned, put back in, have a nice day, enjoy everything you eat because it's going to be wonderful.
So this is like the hottest, newest trend in dentistry, which is replacing teeth with implants.
It's not the hottest, newest thing. It's the best thing in dentistry. It's the most amazing thing that you can do for somebody these days. Where formerly they'd have a denture. A denture can be rough, but a third set of teeth. I mean, it's amazing. It is the best thing that I can do for anybody.
Give them their teeth back. Yes,
give them their confidence, their joy of social situations. I had a lady who came in, said she wanted to be herself again. And I didn't know what that meant, but apparently she was a social butterfly and like a church-going leader.
Okay.
She loved church. Sunday, she lived for Sunday. She came in, she got her teeth fixed, she went away. I didn't hear much from her, but then I started getting friends saying, "I want you to do what you did for Mary." And I'm like, "Who's Mary?" "Oh yeah, I remember Mary." It wasn't just one or two, it was like 6 or 7 or 8 people. So Mary had gone from somebody who didn't really react and respond the way that she liked to in social situations like church. And then she came to us, she got her teeth fixed, she left, and people people were convinced by the way she held herself, the way she talked, the way she just interacted with the congregation around her, and people wanted that. People with great teeth came
her
to me.
personality came
Yes, yes. You'll see pictures in a little while, but people with great teeth came to me saying, "I want you to do it for me what you did for Mary." And I mean, it was like, your teeth are already great. I can't, but you know. It's amazing what you can do for people with a nice smile.
Now your center, because they're apparently it's not always done this way. Normally, dental implants are done. You go to one guy that does, or one person that does the surgery, then another doctor that puts a tooth on top, another place that does the imaging. You have it all right there.
Yeah, we do actually. There's not a ton of guys out there.
Is there an advantage to that?
It's a huge advantage. I mean, one of the things that the patients appreciate the most is it costs less to have one person do something than two or three. That's a significant benefit to a lot of people in that we get things done for generally it's about 10 to 20, maybe 30% of what it costs to get it done by multiple different people. So that benefit alone is fantastic. But also it's the convenience and comfort of knowing just one person is going to be working on you. You don't have to go to the guy that you love and trust, and then go to somebody else that you barely know. You see them twice, and then they're done with you, and then go back to the guy that you love and trust. We do it all.
Now, the top of the show, we said no more dentures. Are there a lot of people wearing dentures, like where you are?
Yes.
In your town?
So there's been studies. When I was in school, it said that 30% of people don't go to the dentist unless there's an emergency. So that 30% of people is eventually probably going to end up in dentures. There's lots of people wearing dentures. About 10% of people wear dentures. So in the state of South Carolina, there's 6 million people, right? 10% of those, 600,000 people wearing dentures in South Carolina. In Charleston alone, 15 to 20,000 people.
So if there's that many people where you are wearing an upper lower denture, why aren't they all coming in to do it, to get a brand new set of teeth? What's your take?
Well, my take on why people don't come to the dentist after they've gotten dentures is they don't really need to. They don't have teeth anymore.
Okay.
They don't see it as a necessity. I mean, I think they probably would feel a little bit odd coming to get their dentures checked. Now, people do come in for a reline and things like that. So the second thing is, if you have dentures, you've honestly been through hell getting there. Okay, you've spent a lot of time in the dental chair. You've had all your teeth removed. It has not been a fantastic road to get to where you are, and there's a little fear of coming back, and it's kind of in the past, and people like to keep it tucked in the past. But the thing about implants and what we can do for people today is we can improve their lives in ways that they never imagined. We can give them a third set of teeth. It's unbelievable.
So how old can you be to do this?
So I have a mentor friend that has a patient that has demanded teeth that don't come out using implants at the age of 101.
Really?
Hey, he wanted what he wanted.
So 101 years old, you get a brand new set of teeth, upper and lower, that don't come out?
Absolutely, yes. He had sedation. He got his implants, he got his teeth, and apparently he's very happy.
So 80 years old is young today?
I've got an 80-year-old that's getting implants done right now.
Why would an 80-year-old want to do this?
Are you not going to want to have a good life when you're 80?
Okay.
I mean, it's a terrific thing, If you don't have teeth, you can't chew, you can't smile, you can't trust yourself socially because you don't know what's going to happen with your teeth. What are you going to do? It doesn't matter how old you are. I mean, if you're old enough and you're willing, go for it. It changes lives. It's a brilliant and amazing thing.
What about those people that have been wearing dentures like 20 years? They don't have enough bone to do this?
Actually, I have a patient right now that hasn't had teeth for 40. She hasn't worn teeth. She had her dentures for 20 years. She stopped wearing those teeth. For the last 20 years, she's just been using her gums. She came to me for teeth. We've done several implants on her this week. She's getting started on lower teeth that don't come out. Okay. She had been told multiple times that she could not do this, but with current technologies and the imaging that we have, the ability to see things in 3 dimensions, we don't dismiss people like they were dismissed years ago. When they come in, we're able to see the facts about every single person in 3 dimensions. Okay. And it's a powerful, powerful thing that brings a lot of people back into the pool of getting, a terrific experience with their teeth that used to think that they were out. It's changed lives. It's amazing. So
you do like guided surgery. I mean, you do the surgery on a computer first or something like that, you said?
Absolutely, yes, absolutely. Within, I'd say 5-10 minutes of a patient coming in, if they are serious about implants and they want me to discover if they can get them or not, within 5 or 10 minutes I can give them an answer, actually plan out their surgery digitally, show them on the screen what it's going to look like, the implants, and we go from there. That's the first thing that we do is we bring a patient in, we talk to them, we get them comfortable, we enjoy each other's company for a while, and then we get down to business. With 3D imaging, I can actually place the specific implant that I use specifically where I want it in each person and tell the patient the options that they have available to them today. And a lot of times it's teeth that don't come out. It's amazing.
We're going to take a quick break. We come back, more about the implant process, what they could expect on day one. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I played music for a number of years, had beautiful teeth. And about 15 years ago, everything just went crazy. It got to be ugly. I had ha 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 laugh like this, you know what I mean? When I would even open my mouth, I try not to open my mouth very much, and eating had become virtually impossible for anything I really enjoyed eating. It was frustrating. My granddaughter says, "People, what's wrong with your teeth?" And so, it kills you. I get a little choked up about it when I think about it, but they went crazy. "Oh, people, your teeth are beautiful now. Can you eat?" I said, "Oh yeah." I don't want to be eating soup at 95. I want to be eating steak and fried shrimp. Do yourself a favor if you really need it and you're having trouble eating and you don't want to open your mouth and laugh and smile, and just do it. If I had it to do over again, I'd have done it 10 years ago.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. And with us, we have Dr. Barganier. Dr. Barganier, welcome back to the program.
Thank you, Randy. It's been a pleasure.
So you brought photos. What are we looking at?
This is a lovely gentleman. He came to our office. He'd seen a few TV commercials and he wanted to try us out. We had a little tagline for a while that said, giving you a downtown look at a, not downtown price, something like that, right? He came in specifically telling me he wanted that. Those are his teeth beforehand. He had the experience of teeth that were breaking, teeth that were kind of spreading apart. He felt like he had gum issues, some redness to his gums that just wouldn't go away. Sometimes he felt like he had bad breath. And he came in, he said he wanted teeth that don't come out. So this gentleman's options were three. He had three options. Number one's a denture. It's a great option for a lot of people. Number two is a snap-in denture. It's a full set of teeth, top and bottom, on 4 implants on the top, 4 implants on the bottom. It snaps in, it stays snug, it doesn't come out socially. You have all the control that you have over your normal teeth with that set, but you take it out at night. The third option, which is the one that he wanted specifically, and that's why he came to us, was teeth that don't come out. He wanted teeth again, right? He's 74, 75, and he'd been down the road. He'd seen dentistry. He knew that there was something possible for him, and he was willing to do it. He came in, he got it done, and I think the picture, says it all.
He looks happy.
This is our buddy, right here. And if you look closely in the picture, on his right eye, you see a little tear.
Interesting. Okay.
Yeah. I mean, it's lovely. I mean, he really, that's the best part of my job. That right there is making people smile again confidently and loving the fact that they're smiling. It's a beautiful thing. It's beautiful to see people go from not smiling, not enjoying, and when they do enjoy, they hide it because they put their hand over their mouth. They turn. They have specific sides of the camera that they have to be on for pictures. And they go from that to this guy. And
what can he eat, by the way? How soon can he eat? After he gets his final teeth in, how soon can he eat?
He was eating that night.
Is that right?
Yeah, absolutely. He came in, he specifically wanted teeth that day. And we placed the implants, we gave him his teeth, we attached them to him. He is not able to take the teeth out unless he comes to us. And he's able to eat, bagels, salad, pizza, burgers, steak. Honestly, he could probably eat nails. Those things are so strong.
So they can bite like a carrot with their front teeth, or they have to be careful?
They can bite a carrot with their front teeth.
So whatever.
Yeah, absolutely. There's with the materials we have today, people can eat more aggressively than they did with their natural teeth because there's not much fear that they're going to break them. So the next case here, one of the things I love about taking before and afters is that you get to see a personality arise. You get to see a change in the way that people present themselves.
Okay.
And this lady is an excellent example of that. So she came in. She wanted to have the spaces in her mouth fixed. The choices were implants or bridges. Okay. Because we do both, we get to give an honest, unbiased opinion on what's going to be the best thing for a patient. And the real world truth of it is, when it comes down to it, it's what does insurance pay for? That's the honest truth about it. Okay. And so with her, she wanted to smile. She wanted to feel comfortable smiling. And she came in for her next cleaning after we had finished.
Nice.
And honestly, I didn't recognize her. The feel of her was like, it was like she was honestly elegant, like just kind of like just easy. And before she was just quiet. She didn't have that kind of like grace that she has now, and it's lovely speaking with her. I mean, it was before, but now there's a lot more of her, and I really enjoy that. It's really cool.
Okay.
Yeah. Okay, so this is a typical granddad that came in. He had a smile that he wasn't ashamed of. He didn't care. The typical guy, just rolling. He's good, but he wanted to look good for his grandchild. So he came in. He didn't want a denture. He wanted implant teeth. We gave him implant teeth, and he actually asked to see his before once he had been in his teeth for a while. And he was honestly shocked at what he looked like before, and I think a lot of people are in that category of not really paying that much attention. But when they get to where they want to be, they're surprised. And it's I think he's a lot happier here than he is there. So look at the after. If you notice, the smile is almost exactly where it used to be. It's framed by his mouth very nicely. The the middle teeth, they're called centrals. They're a little bit longer than what are called the laterals, which are the ones next to it.
Yeah, they look real. I mean, the whole thing looks real.
Yeah, he wanted nice looking teeth. And that's what he got. That's what he got, I think.
It changes his appearance too.
Yeah, it does. It changes more than just his appearance. It changes the way he talks with us. It changes the way that he walks. Some people come in with when they start out with a cane, and by the time they've finished with us, they feel better. They don't feel like carrying the cane with them. They don't walk in with a cane anymore. It's amazing. It's amazing. I'm not saying that we can treat anything revolving around a cane, but the way that people feel determines on how they move through the world, right? And if their smile is making them feel wonderful, they will make choices that are, in general, a little bit more youthful than the way they felt before they got their teeth fixed. So because we do both implants and bridges, other ways of getting teeth back that people have lost, we're able to do both. We have an unbiased opinion. We do whatever helps the patient best. So a lot of people come to our office and they think that they need implants. They think that's the only route because they've heard so much good stuff about them. A lot of those people don't have to have all their teeth out. A lot of people don't have to spend that extra money to get implants to save their teeth or to get a smile back that they're proud of. A lot of people get to just build on what they have. A lot of times their fears are worse than what's actually there. So we get to treat people the best way for them. We don't just do implants and we don't just do bridges. We do both. And we try to take care of each patient just like I would want to be taken care of.
So you have certain patients that kind of self-diagnose and say, Doc, I need all my teeth out. I need a new teeth with implants, and you may have to slow them down and say, no, we can save these teeth.
Super common.
Okay, really?
I honestly believe that every thought that you could possibly have about your teeth as they get to the point where you think you need implants, you're gonna have. So they think everything from I'm fine to this is the worst thing ever, I'm going to lose my teeth. They think worse thoughts than that. But when they come in, we get to give them the peace of mind and help them get to where they want to be, which is in these after pictures, right? I have another one right here.
Sure.
She had a partial. A partial you take out at night. She did not want to do that anymore. She just wanted a smile, right? A smile that stayed in. She thought she needed implants and to spend tons of money. Because we do both, we were able to diagnose and treat her appropriately. Instead of implants, she got a bridge, which, for what she wanted, does the same thing. at half the cost.
Okay.
And she gets to keep her teeth. I mean, she had beautiful, healthy teeth behind that. She just, needed a little help. She didn't need to reinvent the wheel. She just needed to, fix the teeth the way she wanted them fixed. And that's what we did. I have another lady here. She's one of my most. If you look at her eyes, this is her smile.
Okay.
I said smile. I said smile. I asked, please smile. Give me your smile. Please smile. This was the smile.
Okay.
Nothing wrong with it. She had teeth showing. I didn't believe her, right? When she had teeth that she liked.
Nice.
Right? She just wanted to smile. And, a similar thing. Because we do both things, we were able to treat her appropriately. And she got a smile. She got a smile that I think she loves. If you look at those eyes in that second picture, it's just like beaming.
Yeah.
Honestly, for me, the truth of the matter is not the smile. In none of these pictures, it's not the smile, it's the eyes. If you look at the eyes in each of these.
Yeah, she looks happier. They're smiling in the after.
Yeah, you see the appreciation. You see the just joy in their eyes. They say the eyes are the windows of the soul, and if you look at those eyes in that second picture, that soul is a lot happier.
We're going to take a quick break. We come back. More of these before and after photos. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. We'll be right back.
I had dentures, but they didn't fit well, and I didn't like to smile because I looked ugly to myself. When I'd laugh, I'd cover my mouth so that no one would see them. And that's when I said, I got to do something. I don't care anymore. I can smile, I can eat, I can do whatever I want, where I couldn't before. I'm just a different person. Now I can't quit smiling. I smile all the time, and I never done that, except maybe when I was a kid. Before I got my new dentures, I could not eat corn on the cob, I could not eat an apple, bite an apple, I couldn't eat nuts. The things that I really loved. I mean, I love apples and I love corn on the cob, and I hated having to slice it off, but now I can eat nuts. I even ate an apple, and I was going, I ate an apple. I have no regrets of doing this. I wished I had done it sooner. I recommend this place to anybody.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. And according to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have Dr. Barganier. Okay, so you brought a lot of photos. Let's go to a couple of the photos.
So this is a young man that had some teeth that he wanted fixed. They weren't exactly what he wanted to have. When he looked in the mirror, he didn't see what he really wanted to see. Honestly, when we gave him his implants, we gave him his dentures that snap into the implants, he came away very happy, very, very calm. I felt like he had with his pictures. I talked about the personalities and the way that they change when the teeth change. This guy became so much like just easy. He went from, I think, maybe compensating for something he didn't like, and he got into something that he did, and he just became just chilled out and like kind of cool. Like, he's always been cool, don't get me wrong.
Okay.
I really like this guy.
So he could eat whatever he wants.
Yeah, he can eat whatever he wants. Absolutely. So all these people that come in to see us, they have teeth that are not performing the way they want them to, and implants are something that they think is going to save them. But if they can, they want to save their teeth. If they can, and we can do it, they get to save their teeth. If you go somewhere where you don't have the option of saving the teeth, then you get implants. But what if your teeth were good and you got to keep them for another 10 years? That's what we do. We save teeth, and when they can't be saved,
okay,
we give them implants. It's honestly the only way that I could do it. I couldn't just do implants. I couldn't give people something that maybe could have been better, or maybe been done a different way. And that's what I'm good at, is changing people the best way for them, not the way that I do it.
Okay.
But the best way for them.
Okay.
And if there's something that I'm bad about, it's being obsessive about exactly the right thing for each person. And I don't care. I don't care what it takes me to get where I need to go with what I'm doing, as long as I get there in an honest and truthful way, and doing things for people that cost them less money.
Okay.
And giving them something that they might see as better than what they had before, or the better than options that they've heard before, is amazing. It's the only way I know how to do it, and so that's what we do.
So we have time for one more photo.
Okay, so this guy, the last guy that we have time for, is he's a terrific guy. I think he's an artist at heart.
Okay.
He had beautiful teeth, and this is him on stage. He looks like he's having a fantastic time. He evolved to this. Unfortunately, I think it was a combination of medications and some probably fear of the dentist.
Okay.
After we gave him his implants,
was he headed for dentures? Like his option was a denture?
His option absolutely was a denture, and he was unfortunately one of the ones that we can't save teeth on. So for this guy, we gave him implants. We gave him teeth that don't come out on the lower, and he wanted to be able to clean his top ones. So we gave him something that he takes out once a week.
Okay.
From what he tells me, he absolutely loves it.
We are out of time, but the two groups that you talked about, they have really bad teeth, and they're headed for a denture. They don't want a denture. And then there's the denture wearers, but for whatever reason, they're still skeptical. They heard what you had to say.
Sure.
They're afraid maybe of the dentist. What do you say to them?
I'd honestly say just come on in. We have, for people who are considering a full mouth of implants, we have free consults where we allow patients to come in and just talk. We talk, we hang out, we enjoy each other's company, and we help them figure out what's best for them.
Now, we should mention Medicare, Medicaid, and even the best dental insurance doesn't cover the whole thing. So what's the answer?
So a lot of people come in, and honestly, they use financing. We have a company that in our office, we've been successful with about 90% of people. It's really very helpful to a lot of people. It's our job to give people the best, but also make that best affordable. I want to do things for people that I would do for my family, and I want to make it available to them as well. Because of that, we work with some fantastic finance companies that do a terrific job of helping people get what they want.
And you'll work with insurance. I mean, you'll try to get every penny you can out of the insurance.
Yeah, we'll take
that they have.
We'll work with insurance to make sure that we maximize that for them. It's something that's very important to a lot of people, and I appreciate you having me on the show to help people understand that there's somebody out there that cares about them and wants to make sure that they get the best thing for them. And
So no more dentures.
no more dentures.
Do you think
No
you
more
can
dentures.
wipe it out in South Carolina?
I don't know if that's possible, but
Okay.
we'll do the best we can for everybody.
All right. I want to thank you for coming to the show. Good stuff.
Absolutely.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.